is Ella.
And my name is Mary. We are presenting a video on skull positioning.
As a student, one of the most difficult procedures is skull positioning because CT and MRI have taken over much of the imaging.
The purpose of this video is to demonstrate the body's planes, landmarks, and cranial positioning lines,
Explain and demonstrate the basic skull positioning,
demonstrate alternative skull positions,
and show examples of correctly positioned images.
Here is a reminder of the basic body planes, landmarks, and cranial positioning lines used in basic skull positioning. The first one is the mid-sagittal plane, the IPL, the glabella, nasion, and mandibular symphysis. The OML, the IOML, and the ganglion. For the lateral position, there should be no tube angle. The affected side is placed against the board. To ensure no tilt or rotation, the IPL is perpendicular to the IR. The mid-sagittal plane is parallel to the IR. The IOML should be parallel to the floor, center 2 inches superior to the EAM, or halfway between the glabella and inion. Collimate around the area of interest. Marker is placed on the correct anatomical side. Suspend respiration. For a properly positioned lateral image, the sella turcica and clivus are demonstrated in profile. The EAM and orbital roofs are superimposed, showing no tilt or rotation. The IOML is parallel to the IR. This is visualized by the base of the skull being separated from the C-spine. For the Codwell method, there should be a 15-degree caudal tube angle. The nose and forehead is placed against the board. To ensure no tilt or rotation, the OML is perpendicular to the IR. Center at the nasion, collimate around the area of interest. Marker is placed on the correct anatomical side. Suspend respiration. And the mid-sagittal plane is perpendicular to the IR. For a properly positioned Codwell image, the petrous ridges are projected into the lower third of the orbits. There is equal distance from the mediolateral orbital margins to the lateral sides of the cranium on each side, indicating no rotation. The mid-sagittal plane is perpendicular to the IR, indicating no tilt. For the Tau method, there should be a 30-degree caudal tube angle. Tuck the chin in to get the OML perpendicular to the IR to ensure no tilt or rotation. The central ray is aligned to the mid-sagittal plane. Center 2.5 inches above the glabella. Collimate around the area of interest. Marker is placed on the correct anatomical side. Suspend respiration. For a properly positioned Tau image, the dorsum sella and posterior clinoids are visible in the shadow of the foramen magnum, which indicates correct CR angulation and proper neck flexion. The petrous ridges should be symmetrical, indicating no rotation, and there should be symmetry between the mandibular rami. For the SMV, raise the chin and hyperextend the neck until the IOML is parallel to the IR. The central ray is aligned perpendicular to the IOML. For the SMV, the mid-sagittal plane is perpendicular to the IR, center 2 inches inferior to the mentum at the level of the mandibular angles. Collimate around the area of interest. Marker is placed on the correct anatomical side. Suspend respiration. For the properly positioned SMV image, there should be no foreshortening or elongation of the foramen magnum. To show no rotation, the mid-sagittal plane is perpendicular to the IR. To show the correct extension of the neck, the mandibular mentum should appear anterior to the ethmoid sinuses. There should be equal distance between the mandibular ramus and the lateral cranial cortex, indicating no tilt. For the cross-table lateral, there is no tube angle. The mid-sagittal plane is parallel to the IR. The IPL is perpendicular to the IR, and the IOML is perpendicular to the table. Center 2 inches superior to the EAM, collimate around the area of interest. Marker is placed on the correct anatomical side. Suspend respiration. For the reverse Codwell method, there is a 15-degree cephalic tube angle to the OML. The mid-sagittal plane is perpendicular to the IR. The OML is perpendicular to the IR, avoiding any tilt or rotation. Center at the nasion, collimate around the area of interest. Marker is placed on the correct anatomical side. Suspend respiration. For the Haas method, the patient is prone, nose and forehead against the table. There is a 25-degree cephalic tube angle to the OML. The OML is perpendicular to the IR. The mid-sagittal plane is perpendicular to the IR. Center at the EAM, so it exits 1.5 inches superior to the nasion. Collimate around the area of interest. Marker is placed on the correct anatomical side. Suspend respiration.
Thank you for your time. Hopefully this short video was able to remind you of the body's planes, landmarks, and cranial positioning lines, as well as improve your skills in skull positioning and correctly critique your images.